Okay, hi Joyce.
Hi, Joe.
How are you?
Doing very well, thank you.
Great. Well, I'm so glad to talk to you today, and we are all very lucky because you're going to tell us a little bit about parent to teacher meetings, connecting with parents, and talking to parents about their children who may have learning differences. So,
Yeah,
please tell us.
yeah. Well, one of the questions that I get from teachers when we're giving our trainings and our workshops is, how do I talk to the parent? And how do I explain to them the challenges their child is having in learning? Um, so I think the most important thing to understand as a Montessori teacher, when you have children who are showing difficulties in learning and you have to prepare for a parent conference, is understanding that you are not going to have just one conference with the parent about this. And that it's very important that when you enter the conference, that you are calm and professional and feel secure in your knowledge. So I'm going to talk a little bit more about that as we go in this little piece this afternoon. But you're going to have a series of conversations with the parent so that you can build up a relationship, and one of trust, and one in which they know that you care about their child and that you are not complaining about him or that you don't like him, which sometimes I hear parents say if a teacher says anything about a child having a difficulty, but that you truly deeply care, and that you want to explain to the parent how their child is working in the classroom, and how you are helping that student. So if you say to a parent, your child is having difficulty with math, with understanding number to quantity, the very next thing you need to say is, and this is how we're helping your child with that. And the next thing that parents often say is there a way I can help also? So you need to have in your mind a way that the parent can help the child on additional practice for things you've already introduced in the classroom. Some parents can work extremely well with their child. Others really cannot. It bothers them too much if they don't know something, or if they see that they're not as strong in that subject as their older child was, or as their younger child is. And so they get emotional, and then that transfers to the child, and they find that it's not a positive experience. So I always say, if you can help your child and y'all work well together, that's great. But if you can't, it's so much better if you just leave it to us at school, because if he gets a negative impression about his ability in a certain area, he may shut down not only on you, but on his teachers at school. So during your conversations that you're trying to build this trust with these parents, you need the observations that you have done on the student of his strengths and weaknesses. And I always start every conference about their strengths. And that doesn't just mean an academic strength, though he may have one. An example would be many children who are at risk for dyslexia, having trouble with letters and sounds and blending, may be very strong in the math area. So that's something you could talk about. This area is more of a challenge to him at this time. The math area is a strength. Or athletically, your child is really well coordinated, and that's very important that his motor system is developing so well, because everything that the person learns is going to be based a lot on the early development of the motor system and the speech language system. Or it might be that he's not really very strong in anything. He's got a multiple learning difference. For example, he's at risk for dyslexia, he's ADHD, maybe undiagnosed, but it's pretty obvious that he is, even though you're not saying that to the parent. And he might also have an oral language disorder. Well, if you've got 3 different conditions that you're dealing with, that child may not have a real strong academic strength. So the motor development may be something you can point to, or his kindness, his consideration for others, his willingness to always help everybody. These are very important life skills that we need to give as much strength to in talking to the parent as their academic progress. So again, remaining really calm and very supportive in your demeanor. And the most important thing about any interaction between human beings is listen, really listen. Listen carefully to what the parent's thoughts are, maybe their concerns are. A lot of times I see teachers that are nervous about the parent conference. And if the parent is explaining how they see their child, and it doesn't totally agree with what the teacher thinks, I can see that she stops listening and starts thinking, how am I going to defend myself about this? So it's hard to break that habit, but if you can just listen all the way through to what they have to say, even in some conferences that I've been in which I thought this parent is really off the mark, as I listened, there was always these very important kernels of information that they gave me about themselves and their child, which would allow me to talk with them in a way that gave respect for their opinions and also gave them professional information. And sometimes I've had to say to a parent, well, right now we're going to have to agree to disagree about this, but you have every right. You're the parent and you know the child better than anyone in the world. I'm the teacher, spending a lot of time every day with my class, and I really want to help each child, and I'm sharing this information with you for that reason. The teacher and the school administrator need to work together to develop that trusting relationship with the parent, because if the teacher says something that their administrator would not be in agreement with, that can create problems for everybody. So it's always a good idea, if you're going to talk to a parent about difficulties in learning with their child, that you have talked to the administrator and y'all are in agreement about what will be said. If the administrator can be in the conference, that's even better. Both the teacher and the administrator have to work to help the parent have realistic expectations. Because if this child, who is developing in the 3 to 6 year old early childhood classroom, does have and is diagnosed with a learning disability or learning difference, then the expectations of parents have to be adjusted. They can learn, but it may be slower. It may require a lot more repetitions. It definitely requires therapeutic strategies. But with those things, the child can learn. So if a child's had an assessment and you have it and have looked over it, be sure that you understand it or find someone that can explain it to you. And then if you're talking with the parent, if you can explain in layman's terms what that assessment means. And I always ask the parent, do you agree with this assessment? Does it seem like this picture that's painted by these different measures that the child has completed depict what you see? So in the book that I wrote with Dr. Sylvia Richardson, Montessori Strategies for Children with Learning Differences, chapter 10 in that book, written by Dr. Laurie Ames and I, talks about observation, targeted and guided observation, and it talks about assessment and explains a lot of assessment terms. So if your school has, and I hope if they don't, they will develop sessions for parents, which would help them understand their child with a learning difference, and often offer those sessions on a regular basis. Comfort the parent with the knowledge that their child is in an ideal environment and that the Montessori method is a good match for all children, including those with learning differences. And realize that parents are going to usually take time to understand their child's learning difference, and the process can take sometimes a year or more. Some parents are very fearful of knowing that anything could be, in their mind, wrong with the child. A calming presence can help them not to overreact to differences that actually can be addressed and the child can be helped. That's the important news. Some parents feel guilty about the fact that their child has a learning difference, and often the reason that they feel guilty is they have the same difficulty. And it's just overwhelming to them to think that they have to have a child that's going to go through some of the struggles they did. Well, their child doesn't have to go through those same struggles, because we know so much more about these differences now and how to help each child. Be sure as a teacher that you do not give the parent a diagnosis. You may have read a lot or know a lot or have a child with a diagnosis, say of dyslexia, but you don't give a diagnosis. What you do is describe the characteristics that you see as you observe. And if the parent, which they often do, says, well, does this mean he has a reading disorder? Or does this mean that he has a reading disability? Or some even say, could this be dyslexia? You can say there are the characteristics, but I'm not a diagnostician. And that diagnosis has to be given by a psychologist, neurologist, psychiatrist, or educational diagnostician. It's always a good idea to have that assessment as early as possible, so that the school has information that can allow you to help your child even more. Some parents are afraid of assessment. They're afraid their child will be, the word they use is labeled. They're afraid their child will be seen as different. Well, the reality is their child is different in some ways, and that this is okay, and this needs to be accepted within the parent's heart and mind. So counseling them and being patient with them and helping them to understand more and more is what we need to try to do. So in order for the teacher to have the knowledge and training to help a child in a Montessori classroom who has these learning, language, or attention differences, the administrator of the school really needs to provide professional development to their teachers. they're well-trained Montessorians, but they do not have the background knowledge of these varying exceptionalities. And that knowledge is important because it will help you apply the Montessori lessons to this child in a way that he can make progress and feel that he is learning, and that will help him develop a better self-concept and more confidence in himself. So presentations on learning differences, the types of learning differences, definitions and characteristics that can be observed at all ages and stages are in Chapter 6 of the Montessori Strategies for Children with Learning Disorders and Differences. An overview of assessment is, as I said, in that Chapter 10, and would help you interpret a diagnostic report that the school may have. Presentations on applying Montessori education to children with varying learning differences is in Chapters 4 and Chapter 6. So since we don't have unlimited time, I'm referring you to some chapters for more information on this book, which I think, as you know, is available through Parent Press, Parent Child. I would recommend to every school that they have a team of the administrator, some teacher reps, some specialists like speech language pathologists, some parent reps, and they get together and discuss and create the school's plan for serving children who learn differently. If the school doesn't have a plan, then they will constantly be reacting instead of being proactive in providing the services they can and helping the parent to understand their child. So there's about 20 to 30% of the children in any school who learn in different ways. This is almost a third of the children in a school. And that's what makes this urgent. Paula Polk-Lillard describes the impact of Dr. Montessori's method for this population in her book, Montessori, A Modern Approach. And she says, with these children where many steps usually taken for granted have been missed in earlier years, it can make the difference between the success and failure of a human life. And that's how important this is. It's not at all an overstatement. If a child can be successful in school, they will feel good about themselves, and they will, even having to work very, very, very hard, if they have the support they need, they will have a good self-concept and be able to progress into the person that they should be. If they don't have that help, it's very frightening for a child, and it often results in anxiety, and as they get older, even into depression. So having a learning difference is not just a minor thing. It is an educational problem, and then it can become a mental health problem later on in life. So it's really important that parents and teachers understand these children who learn differently are not brain damaged. They do not have an abnormal brain, but their brain is different. It's different anatomically, its anatomy, and it's different in the way it processes information. And therefore, the teacher has to teach in different ways. And professional development can help them know those ways. I hope this has been helpful. I'll always be glad to answer any specific questions that you have. You can email me at jpickering@shelton.org. Thank you.
Wow, that is really incredible, Joyce. And I know that you've helped so many children and so many families, and I really appreciate you sharing your wise words with us today. Um, is there anything else you want to say?
No, I think we've covered it unless you have a question.
No, but I just do want to remind everyone, come to montessoriservices.com to order Montessori strategies for children with learning differences. Um, and we will see everyone again soon.
Okay, thank you, Joe.
Thank you, Joyce.